Hi, I am Dr. KP Rajesh, consultant diabetologist and physician, PVS Hospital, Calicut. Today we will be discussing regarding high blood pressure and its effect on the brain. What is blood pressure? Blood pressure is the vital force at which blood is transmitted from the heart through the blood vessels to the various tissues and organs in the body. The heart acts as the pump which generates the force, and the blood vessels are the conduits which transmit this blood from the heart to the various organs in the body. Now, we are all aware that high blood pressure affects the heart, but many of us are not aware of the heart that high blood pressure affects the brain as well. Now, how does high blood pressure affect the brain? Now, when there is high blood pressure, it leads to atherogenic plaques, which leads to narrowing and thrombus formation in the blood vessels. Even at high pressures, it could damage the vessel wall and can lead to breakage of the vessel wall and bleeding. So, these effects can produce various changes and can manifest in different forms in the patient, starting from transient ischemic attack to a full-blown stroke or a mild cognitive impairment to a full-blown dementia. Now, what is a transient ischemic attack? Now, transient ischemic attack is due to a temporary cessation in the blood flow to the brain. Now, we call it by the term mini stroke. Usually, the patient recovers spontaneously, but transient ischemic attack is a warning sign that the patient is prone to develop a stroke in the future. Now, when you come to stroke, a stroke is due to a complete cessation in the blood supply to certain parts of the brain, leading to brain cell death in certain parts. It can manifest in various forms. It can present as a weakness of one or more limbs in the patient, or it can present as difficulty in vision, difficulty in speech, or the patient can have imbalance while walking. Now, when we come to the cognitive impairment, that could be a mild cognitive impairment, or it can present as a full-blown dementia. Now, dementia is difficulty in perception, understanding, speech and memory in the patient. The patient can also have visual disturbances and gait disturbances. Now, there are several reasons for dementia, but the most common or one of the common reasons would be a vascular dementia, which is due to a decrease in the blood flow to different parts of the brain. And one of the major culprits in vascular dementia is hypertension or high blood pressure. Now, we have seen that blood pressure can affect brain in several ways. Now, what is the risk when you come to a patient? There are several studies which state that high blood pressure is a very significant risk factor for the development of stroke. The higher your blood pressure, the higher the risk of stroke. There are several studies from Harvard which says that the patient with high blood pressure has almost 220% higher risk of developing stroke. That means the risk is almost more than twice the risk of a non-hypertensive patient. There are also studies which says that if the systolic blood pressure increases by 10 millimeter of mercury, it increases the chance of an ischemic stroke by 28% and that of a hemorrhagic stroke by 38%. Now, that's quite a lot of risk and that's a bad news. But the good news is that if you treat the hypertension, it is extremely protective. So, if you are able to reduce the blood pressure by 10 millimeter of mercury, you can reduce the risk of developing a stroke by a whopping 44%. So, there is a significant effect of reducing the blood pressure. Now, what we need to do to reduce your blood pressure? Okay. So, how can you reduce your blood pressure? The first and the foremost thing you need to do is to know your blood pressure. The data suggests that almost 50% of the patients with hypertension are not aware that they have a high blood pressure. So we call it as a silent killer. So the first and the foremost thing you need to know is to check your blood pressure. Or we tell the patients, know your numbers in both hypertensive and diabetes. So any patient who is above 40 has a family history of hypertension, or the patient who has other conditions like diabetes, coronary artery disease, obesity or hyperlipidemia needs to check his blood pressure. The next thing you can do is to modify your diet. A good diet helps you reduce your blood pressure by almost 10 to 20 millimeter of mercury. By good diet, what we mean is that you need to reduce your salt intake, reduce the intake of your saturated fats, and reduce the intake of your processed foods. By salt intake, the recommendation is usually 5 to 6 gram of sodium chloride or the common salt in your diet. But the Indian diet usually has around 10 to 12 gram of salt. So that means our diet usually has more than the recommendation of the daily intake of salt. And on top of that, we are consuming or topping it up with extra salt. Like nowadays, we see the intake of salted cashews and salted almonds. Okay, instead of taking the usual nuts, we take it more of a salted. Okay, so we need to cut down on that. And we need to take more of fresh fruits and vegetables, whole grains, and drink a lot of water. The next thing would be exercise. So moderate intensity exercise actually helps to reduce your blood pressure by 4 to 10 millimeter of mercury. So what do you mean by moderate intensity exercise? You can do anything from jogging, cycling, skipping, swimming, badminton or a football. But the easiest thing would be to take a brisk walk of for 30 to 45 minutes a day. And this will highly help you in reducing your blood pressure. The next thing we can take care of is reduce the weight. If an obese patient reduces his weight by 20 pounds, it actually helps to cut down the blood pressure by 10 to 20 millimeter of mercury. This is in addition to the effect caused by diet and exercise. The next thing we need to take care of is alcohol. So light to moderate intake of alcohol does not increase the blood pressure, but anything more than that does. So this does not mean that you have to consume light intake of alcohol. It only says that there is a cutoff. And finally, last but not the least, would be the role of stress. Most of us experience stress in our personal and professional life. When it comes to profession, most of us are behind targets. So in the race to achieve targets, most of us are stressed out, and this in turn causes hypertension. So how can we reduce this? So you can take up some hobbies, or go in for some yoga or meditation, or listen to movies or music, all those things which can help in de-stressing. And this de-stressing in fact helps to reduce your blood pressure. So these are the things which you can do on your own, and you can also get the help of your doctor who can examine you and prescribe you medicines according to your clinical situation. So finally, the most brainy thing you can do to control or help your brain, to protect your brain, would be to control your hypertension. Thank you.